Good Saturday morning to you, and welcome to the Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. You can find her online at the burlingtondentist.com. And you say dentist. Yeah, she's a dentist. But this is, for the purpose of this show, we're talking sleep and all things. It's something everybody does. You know, I suppose you don't need a dentist if you have no teeth, but you do need to talk sleep because you sleep. 860-673-7155. Again, 860-673-7155. And by the way, you can get a free sleep assessment. This is like a $250 value here. This is big bucks, and it's for the first 5 callers. So you got to be, the race is on, doctor. Race is on. First 5 callers right now. 860-673-7155. Operators are standing by. A $250 value, sleep assessment. I mean, it's win-win. Good morning. Great to see you, by the way.
Yes, you too.
It's Mother's Day weekend.
I know.
You're a mom. Happy Mother's Day.
I know. I actually treated myself to 2 beautiful hanging baskets for Mother's Day. Yeah, because my kids didn't live nearby, and I wanted some.
But it's still Mother's Day. They send you something?
Oh yeah, they send the card.
Hey,
I know it is what it is, but they don't live nearby, so
not driving distance. Huh? Would it be?
No, they're in Florida.
Oh,
so
no.
They're not even close.
I've driven.
I can't say come over and mow the lawn. You know, it doesn't work that way.
You have a boy, girl.
I had 2 boys.
2 boys. Yeah. Okay, they're both in Florida. Will mom be following suit at some point in retirement, maybe?
What? I don't know. I like Florida for a short time, but I hate their summers, and I don't.
Well, that's why they're snowbirds. They're up here in the summer and down there in the winter.
And then you maintain 2 houses. I don't know. I'm still working, and I still work a lot of hours. So, although this summer I'm going to actually only work 3 days a week. I'm giving myself a day to do stuff at my house.
What will your 3 days be?
Monday, Tuesday, and Thursday.
You're going to take Wednesdays off, huh?
I've taken Wednesdays off for quite a while.
All right.
But now I'm going to take Friday.
Well, look, you take Friday off.
Yeah.
You have a nice long weekend.
Well, you get into a project and you pull everything apart, and I'm trying to get rid of old stuff and go through things.
Is it fair? Can I ask you, if it's too personal of a question, you don't have to answer it, what will you do with all your newfound time?
Well, I'm trying to write a book. So that's taking up some time.
Fiction, nonfiction?
No, a sleep book.
A sleep book,
yeah.
Okay.
So my brother's like, hurry up and write this book. I'm like, because I have a different viewpoint, which is why I express it here on this show. Some people are very by the book, and I'm kind of like, the book doesn't always work.
And you're like, I want you to buy my book.
Well, hopefully when I finish it.
How far along are you in it?
I have a lot of data, to put it this way. I've got subjects, and then of course I go back and it's never finished because I'm like, oh, there's something new that came out, and that doesn't help me because I'm like, now where do I put that in it? The chapters are getting a little long, and I don't really want it to be too long. I really want to make it very readable for the public.
Under 250 pages?
I have no idea. I've got so
many. You could write a sequel, write 2 books.
Well, that's what my brother said. He was like, well, just write another one. And I'm like, it's not that easy, because I feel like I have to start with some premises of information.
Do you have
basics.
a publicist? Do you have a publisher?
No,
or are you going to self-publish through Amazon?
I could do that too. I could do that
keep
too.
all the money yourself.
I could do that, and I could make it an ebook, so it might be easier,
Well, it's both.
Oh, does it? I don't know enough about it yet.
Oh, sure.
I have one of my friends that's like, tell me when you're ready. I'll have a publisher for you. And I'm like, oh my gosh. So,
well, look at you.
I know, but it takes time. These things are complicated. And I feel like I've got to go back and kind of.
Shouldn't have to be.
Well, you'd think that, but it's a lot of patient cases that I've done. I could use some of those as stories in there so that I can make people understand why it works the way it works. And why it's so important to have the testing and the screenings. I mean, we've talked about this 8-year-old who has severe sleep apnea, and he's actually going to go through surgery with the ENT in another couple of weeks to get his adenoids removed, because when we did his cone beam, he couldn't breathe.
Isn't surgery a last resort for just about everything?
It is, until you can't breathe. Okay, so I go back to, and I've said this over how many months now, breathing to me is the essential, most important thing. Breathing through the nose.
Oh,
No,
right.
breathing through the nose.
Through the
You can
nose.
open your mouth and breathe, but you need to breathe through your nose. And the problem is that people just open their mouth and they breathe because there's not, oh, I can't do it this way, I'll do it that way. That isn't a brain thing. You don't even think about it, just going to open your mouth and breathe.
You know what? I'm trying to remember who the person that was that told me, breathe through your nose,
Yeah.
not your mouth.
Yep. Because there's several hundred functions
was
that
years
the
ago.
nose
I don't know
that the
who it
nose
was.
does. But I tell new mothers always close the baby's mouth. Constantly do that. You need to teach them to breathe through the nose. And so this young man, he's got severe sleep apnea. He's got a lot of other issues as well because of that. And when we saw him so clogged up on the cone beam, which is, the 3D x-ray that I take, I said, he needs a pediatric ENT. Like, you need to do that now. And we'll have the appliances all ready to start him when he gets done. This ENT was like, oh my God, his adenoids are huge. Okay. And his tonsils weren't too bad. So for a mouth breather, that was pretty good. But he cannot blow his nose. He cannot get air through the nose. Exactly. So this poor kid has been sitting there and nobody has noticed. Okay. So she brought him in, not for a sleep problem, by the way, not for a breathing problem either. She brought him in because she wanted to know if I thought he was tongue-tied.
Oh, really?
Yeah. So see, people come in for various things,
different
and
reasons.
it's like not what you think. And I'm going, I think he's got a sleep breathing problem.
You're so versatile. You really are. And I keep forgetting you're a dentist.
I know, but I read constantly. I'm on Google Scholar and PubMed, and I'm reading articles all the time. I read my Substacks. I really feel like there's so much information out there, and I don't want to say that some of the physicians are lackadaisical, because I don't believe that. But I think they're so busy trying to survive in their practices with their day-to-day stuff that they're not paying attention to some of that. I don't think they really realize how important it is. That's why I emphasize the screenings. The kids need to be screened. The adults need to be screened. People need to be screened, and not just one time in their lifetime, right? You need to have it periodically because things change. It's the people that I see that I go, I think you got some hormones are kind of mixed up, and I think your cortisol levels are a little high, and it's kind of like, so tell me more about what you're doing. We need to change some things, right? One solution doesn't work for all, and that's what most sleep physicians do. So if you don't qualify for the CPAP, what do they have for you? Nothing. Nothing. You get to wait. So people get frustrated, right? And so then the dentist, and these are facts, and nothing to do with what we're going to talk about today, but 30% of people do not get a resolving issue by wearing a sleep appliance. Why is that?
Yeah.
Okay? So think about that. Why is that? Because they're never addressing the breathing problem. Okay? They're not looking at how the nose functions like I am. Okay? They're not looking at the diet like I'm looking at it. So, and listen, none of this is hard stuff. It's just, like I said, I play like Sherlock Holmes. I'm like asking more questions. I'm very curious. Why does this not work this way? And I don't always have all the answers. Trust me, I don't. So what I say to people is, let me do a little more reading on this, because you just have told me something that's, like my brain goes on, I like to say it goes on the fritz, right? It's like, wait a minute, that doesn't compute. And I need to figure this out. And so I will read until I get a satisfying answer that says, that's why it's doing this. Because not everybody is simple.
I want to change subjects for a moment here, because just this past week, MAHA, Make America Healthy Again, gave out a report that the medical profession needs to cut back giving out prescriptions for antidepressants and the like, okay?
Yeah.
And that they need to try other alternatives first. So
Right.
how does this relate to our topic of sleeping disorders and sleep apnea and so on and so forth?
So the number one drugs that they prescribe are what we call SSRIs, okay, which are like your Prozac, your Paxil, your Zoloft, those Lexapro, I think, is another one. The problem with those medications is they start these on these kids when they're really little. And the people that testified, and I actually read that report.
Not surprised.
Yeah. Yeah. So when I read this, they had several young people testifying at this hearing, I guess you would call it. And one girl said, I can never get off these medications. I've been on them since I was 6 years old. And they gave it to her because the teacher said, oh, she's a little too fidgety. She's not paying attention in
it's
school.
A pill for just give them a pill. That's all.
Exactly. So they put her on Prozac at that time.
Prozac?
Now, you have to remember.
At 6 years old?
Right. Now, you have to remember. This is what she's testifying to. So I had a 17-year-old that came in, and she's on Prozac also. Now, it's not a huge dose, but I'm like, why are you on that? She goes, oh, I have anxiety. And I hate to say it like that, but I get really upset because the father's sitting there, and he's like, it's okay with him. And the doctors are doing this because the patients are asking for a medication, right? If they stopped advertising this all on TV, I think we'd do better. And there was a time, and I'm just going to go back, this was many years ago, all of a sudden graduation presents were, oh, get a nose job. Graduation present was, oh, you can have breast implants. Do you remember those days?
Oh, yeah.
Okay. They've come and they've kind of gone, right? This is one of those other like, oh, I'm taking my anti-anxiety medication, and I'm making fun of it here for a real intentional purpose. Does she really need this drug?
That's the first thing that popped into my mind.
Okay. So I said to her, there's other ways of getting the anxiety reduced, right? You could do vitamin D3. You could do a 5-HTP, which actually elevates your serotonin levels in a natural way. You don't get any side effects from these medications, these supplements. And so, but she's taking this drug. Now, long term, this woman can never get off this medication. The withdrawal is so painful and so bad, I can't get off these medications. And she's 22, 23 years old, who's testifying. The other lady that testified, it's even sadder. It's actually affected her sexual function.
Oh, no.
Oh, yeah. She can't have an orgasm. She has no sensation. She's like, I love my mother, but I feel nothing anymore. It's numbed all of my feelings. Now, can you imagine? She's only 20-something years old, and she's now cursed for the rest of her life because she took these drugs. So they are not fully, and this is my complaint about it, they are not fully informing the patients of the side effects and the possible consequences of taking these medications.
They're irreversible side effects?
These two people that testified are irreversible.
Usually when you stop taking the medication, you go...
How many years are they on it? At what dosage? And are they increasing it? Did they add other medications with the
month,
mix?
2 months? I mean...
No, they've been taking them since they were young. So I look at this and I say, okay, if you're on it for 2 weeks because let's say you had a death in the family and you're very distraught. I can understand a couple of weeks, maybe
even a month.
Right. And then get off of the medication, okay? But sometimes it's sort of like what I see with the GERD drugs, and you get heartburn. They're on it forever.
What kind of anxiety at 17 years old?
So she's.
You got an exam, or you got a boyfriend? Right. I mean, okay, we all have. We all went through stuff like that. We weren't on Prozac.
Right. And that's why I'm saying this. And so for Maha to have this meeting and have this testimony and this report put out, I think the timing is just so very important, which is why when I'm putting this together to talk about what I see in my office, I was like, oh, this report was like so wonderful that they did this. And it's not to say that these medications aren't good. The medications can be good, but they were never, ever, ever designed to be on for year after year after year after year. And not only that, but sometimes people become toxic to the medication. Going off of it to get on another medication, they're in the hospital. They're so bad.
Yeah.
Now, my sister did that. She took Prozac, and then she became toxic to it. Getting her switched to another medication, she was in the hospital for 5 days. She was a mess. The withdrawal from these medications is so bad.
So do you have to gradually wean yourself off of that, as opposed to stopping cold turkey?
Right, you can't stop it cold turkey. even if you've been taking it for a few weeks.
Otherwise, you withdraw.
So we have to
and-
remember, withdrawal is like, I mean, you think about like heroin or cocaine or something
What,
like
do you
that.
get the DTs or something, or
It's worse.
is it?
They actually get pain. They get blood pressure drops. They
Probably
get
sick to your stomach,
Yeah,
too.
they get that, but they can't function. They can't function. So everybody goes through this a little differently. I'm not going to say it's 100% across the board, and it depends. Now, every physician out there is going to hate me now because I'm saying be careful, and they need to. I think we're headed to a fully informed consent because of some of these side effects that these other young people are experiencing because they've been on it for probably 15, 20 years. So think about where we've gone. And I hate to say it, but after we had 9/11, what did I see on the news? Oh, do you have anxiety? You need a drug. Oh, are you upset about what happened? You need a drug. I really feel like these people should not be allowed to advertise on TV or in the social medias. I just don't think it's appropriate. That's my personal, and I'm saying that.
No,
that's my
I think there's a
personal
lot. In
feeling.
fact, I think there was a movement to try to obtain that. But I mean, the TV industry, they make a lot of money on pharmaceuticals.
Well, yeah, and the pharmaceutical companies are making a lot of money on it too.
Yeah, well,
And-
from the
and-
doctors
and-
who prescribe them.
And people prescribe stuff because you walk in and ask for it.
But you're a dentist. You prescribe.
I can't prescribe those.
No, not those. But you prescribed steroid or
I can prescribe. I do. So I try
Clinda.
I try to stay away from a lot of prescription medications. Okay, I really very rarely.
Well, if you have an extraction, I would imagine you
no, I don't need to.
just take Tylenol.
No. So when I do an extraction, I actually draw their blood, spin it up, and I put in PRF into the extraction site. When I do that,
So they're
the
healing
bleeding all
themselves.
stops, the pain goes away. I mean, and it heals very quickly. So they might take one dual or two dual action Advils, which is a Tylenol Advil ibuprofen combination. They don't take medication. I don't have those problems, and I do a lot of surgeries.
So what do you take for pain relief?
That's what I take. It's called a dual action Advil. It's got a combination of Advil and ibuprofen.
All right. Folks, you are listening to The Sleep Show along with Dr. Bethaney Brenner. I'm Gary Byron. You can call. Oh, yes. I want to give you the number, but I want to give you the special as well. I want to take full advantage of this at 860-673-7155. Let me give that number again, 860-673-7155. First five callers, I should say, that call that number. You're going to get a free sleep assessment. It's a $250 value. I'll give you more details on that more towards the end of the show. And I'll give you an email address as well. A lot of SSRIs are handed out. You know, you're just talking about Prozac, right? Zoloft, Lexapro, Paxil, and the like. I mean, these drugs, they interfere. I don't want to say it affects everybody's chemistry different. You can see zombie-like behavior, can't you?
Yeah, so it's also dose dependent. So a lot of these younger people, they're put on a low dose.
But they interfere with sleep.
Yes. And so this young 17-year-old that I saw, not only did she have a lot of fragmentation, she had a decreased REM. So what does that mean? It means that all of the downloading that you did for what you learned yesterday, we're not fully downloading. So we don't remember everything. We're not putting in, I'm going to say we downloaded into our hard drive, so our permanent memory. That gets harder when your sleep is disturbed. And she's got such mild sleep apnea. And I'm looking at this and I'm thinking, why are we on them? And so I questioned it. I said, why are we on this medication? You could do this in another way. It's disturbing the sleep enough. So some of these people, and she also had this problem, she has trouble going to sleep, insomnia. Now, I don't diagnose insomnia, right? But they have trouble going to sleep. It takes a long time. Now, normal amount of time to go to sleep is 10 or 15 minutes. People sit in bed and think they're going to like drop off instantly, and it's like I toss, I turn.
Well, people read, I
understand, but they think that they should go to sleep instantaneously when they put their head on the pillow, and it doesn't happen like that. There's a natural kind of
wind down.
Yeah, right. So the body has to go, okay, they're finally going to lay down and close their eyes, right? We've talked about blue light. Blue light's a stimulant, right?
Very much
and,
so, yeah.
And so that comes from our phones and our iPads and our computers. And I see people sit in bed on their computers, okay? So is that a good idea? The answer is no. One of the other things that we see is that when they take these medications, now they're supposed to take them in the morning so they're not so drowsy during the day, but some of these people are drowsy during the day. So the very first time I met this young 17-year-old, she could barely sit up in the chair because she wanted to go to sleep. And I'm looking and I'm thinking, what is she on? I mean, my first thought in my brain
Narcoleptic?
is, no, why is she so tired? 17-year-olds should have a lot of energy. They're still,
growing.
I was like a whirling dervish. I was involved in sports. I was involved in stuff that was going on with school. I was busy in my classes. I took AP courses. I mean, I was a busy girl, right? And thinking I would be tired and slumpy and being like, I need to go. I was not like that. And I went to bed at 10 o'clock every night, and I got up at 6 o'clock in the morning, and I was raring to go again. So I look at this, and so what helps with that? So what I'm seeing people come in, and they're sluggish, and I can't go to sleep at night, and she's on her phone, and I'm thinking, okay, so you see, we've talked about some of these things, but that's the effect of some of these drugs on people. In this particular young lady, she did that. The other thing, and SSRIs are known for it, is causing more grinding and clenching of your teeth. We call it nighttime bruxing, okay? So that creates jaw pain, face pain, headaches. You're using these muscles, and the muscles get sore, and they let you know. So we see that, right? So she's talking about her headaches, but she's like, they're not so bad. Yeah, so I see a variety of things, and the arousals that we see that increase with this because it disturbs the sleep, that fragmentation. Oh. So sleep apnea won't kill you, okay? That's being in the pot. Remember I talk about the lobster in the pot? You can cook it. You can cook it on slow, or you can cook it on high, right? It still dies in the end. So sleep apnea is like death by 1,000 cuts, all right? Micro arousals are worse, because it's always disturbing your sleep. You're never getting into good, deep sleep. So I look at this child and I'm thinking, is she getting into a good, deep sleep? Okay, so when we see the sleep results come back,
No.
The answer is she's not horrible, but she could be better. And she's 17. Why are we on the medication? Why don't we try it without the medication and see what we can do?
I've only got a few minutes left. There's non-prescriptions, right, that can help with anxiety?
Yeah, so I talked about 5-HTP. That increases your serotonin. Serotonin is a kind of like a feel-good drug, right, that our brain makes. We make it ourselves, right? So, and how can you increase that? You can do exercise. A lot of exercise makes people feel better, right?
Gets you tired, too.
It gets you tired. But it's a good way to burn off stressors.
Sure.
Right? So, and I talk to people about stressors all the time, right? Cortisol levels go up, kind of disturbs a whole bunch of stuff, especially in ladies, because it messes with our female hormones. And people are like, oh, yeah, I'm definitely stressed. Everybody feels stressed today. There isn't, and I'm like, so 100 years ago, you don't think they were stressed? They didn't have microwaves and fast food.
Or cars.
They didn't have any of that stuff,
yeah.
right? So they were stressed too, but they were stressed in a different way. But we didn't have lights that were on. They got to go to bed at a normal time. They slept differently. We didn't have those medications, right? So people actually slept better 100 years ago. It's a fact.
Yeah, I'm thinking 100 years ago. Yeah, that was only, 1926. I'm thinking in the 1800s when they would take stagecoach, and they didn't have heat in their house. They had to light fires and
right. And you had to constantly be maintaining things.
But they also, you don't know. We're comparing it now in hindsight. Yeah. Back then, they were just living in the era.
Exactly.
They had nothing. They weren't going to compare it to the future. You don't know what the future had.
Right.
So you don't know what you don't know.
But they still had yoga back in then. They didn't call it yoga, right? They had people who were doing. They had some information from certain people who would do stretching, and it's not well known. They didn't have like a gym that they went to or a Pilates class. Okay, they didn't have that, but they had sit up straight while you're eating your food, right? So posture was really important. You didn't see a lot of schlumpy people, right? You saw people standing up straight, body upright, breathing more deeply. And why? Because they weren't bent over a cell phone. They weren't bent over an iPad, things of that nature.
Really quickly, because I got to wind this down. I got about 2 minutes remaining. I mentioned a couple of times in this show a sleep assessment. It's about a $250 value. What does that entail?
So I'm going to look at several different things. I look at their posture, and we'll talk about that next week. I'm looking at their medical history. What are they taking for medications? How do they feel? How are they answering? And I've said this before. My form is very intense. It's a lot of questions, but their questions are very important in this because all of these things add up. So I had a gentleman that came in, and he's a personal trainer, bodybuilder type, and he said, I only snore. Well, I know that's not possible. So I said, so do you wake up at night? Oh, yeah. Well, how many times do you? Oh, I wake up 2 or 3 times. Okay, so we need to check that box.
His own snoring is waking him up?
Well, he's waking up. So my point to this is that there are other questions, and you have to think about it. And you're not reading he didn't want to read the questions. He just wanted to get the snoring fixed. Okay, I get that. But there was more things that were going on. And as we started to go over the questions, we started to check off more boxes. So I look for things. I also look at, have you had trauma to the face? All right, so people have been in car accidents. I had a woman that had facial reconstruction because she was hit head on. Those are the kinds of things. I'm looking for a variety.
All right. Yeah. So, a comprehensive would be the word to describe it. It's a $250 value. You're going to get it free right now. Be one of 5 callers. The first 5 callers at 860-673-7155. Again, it's 860-673-7155. Or you can simply email at drbrennerradio@gmail.com. Dr. Brenner Radio, BRENNER, radio@gmail.com. Your offices are right here in Burlington, Connecticut. You can find her at theburlingtondentist.com. Very nice. I look forward to next week. For Dr. Bethaney Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next Saturday morning, have a good one, everybody. So long.